All right, so we're looking at, I guess this is chapter 11 of the senior manual. This also corresponds similarly, like I said, to chapter 20 in your regular NASM textbook. But this is basically the common medical conditions and what type of like adjustments we need to make for those medical conditions. So these are going to be very similar to the comorbidities that we talked about in our last course, because we know that like obviously most seniors are suffering from one type of chronic condition or chronic condition or disorder. It's very, very common as we get older. There are definitely some physical limitations that kind of come along with certain diseases and stuff. And so we need to be aware of what those limitations are and how to make adjustments. And that's kind of what we're going over today. So first we're going to look at is regular old cardiovascular disease, right? So this is, number one killer of males and females. Generally, when we're talking about cardiovascular disease, we're talking about some variation of coronary artery disease. This, like I said, this is the number one cause of, what is the leading cause in the U.S.? Leading cause of death in the U.S. Heart disease make an account like 659,000 a year. Cancer is definitely creeping up there. But look at that. We can see like it goes from 650,000 to 600,000 down to 173. It's like a pretty drastic freaking drop. So we know that like, and it's frustrating because cardiovascular disease is, for the most part, something we really shouldn't be dealing with. Like this is our heart. It's this organ that's designed, it's designed to work the way it's supposed to. But we live in a world with access to things like McDonald's, and we've got a very sedentary sort of world that we happen to live in. So that's a big part of the reason why like it tends to be pretty high on the list. There's sort of 20 different cardiovascular diseases out there, but the majority of the most dangerous one is definitely going to be coronary artery disease, which is basically the biggest cause or the biggest leader in cardiovascular disease related deaths. So what is coronary artery disease? Well, this is an accumulation of damage to the walls of the blood vessels of the heart itself, right? So if you think about like, when you look at your heart and you look at your coronary arteries, they loop around, and their job is just like any other, blood vessel. They're designed to like cover the tissue and supply that tissue with blood flow, right? And that's how that tissue is going to receive, oxygen and nutrients and things like that. So if you build up like fat on the inside of any blood vessel, it's going to create, an increased pressure, right? When we look at like plaque, if we look at like plaque in a blood vessel, right, we see like this is going to cause, sort of a traffic jam here, right? Like there's going to be increased pressure. We might experience like clotting in the cells. Not exactly, not exactly good for us, right? And that's dangerous in any blood vessel. But if it happens in your coronary arteries, that's where this gets really, really dangerous, because you're basically blocking delivery of nutrients to keep the cells alive in the thing that's pumping oxygen and nutrients throughout the entire body. Like this is the organ responsible for powering your entire body. And if you shut that down, you're screwed. Like your CD player can go out in your car, but if your engine goes out, you're in trouble, and that's not something we really want to experience. So basically fat builds up on the inside of those blood vessel walls, and that decreases the amount of blood that can travel through those blood vessels and, deliver nutrients to the heart. And so, obviously, like as we get older, we know that there are like, structural changes that happen in the heart. And those structural changes sort of make us more prone to dealing with this, right? Like, honestly, the damage to the heart happens throughout your life. It's not like one day you're just, you hit 65 years older and you get your AARP card, and then all of a sudden, like, you know, you also get like a delivery from like, oh, and your heart just started building up like that. This is something that kind of builds up slowly over the course of your lifetime, but we don't really notice a lot of it until we get older, when the heart, you know, starts to not contract for quite as much force and stuff, right? So obviously, like, you know, we definitely want to make sure that we are exercising to sort of combat this. We know that if we're using our heart more efficiently, we are pumping blood more often. It really never has a chance to kind of build up on those walls. We also know that exercise actually burns up cholesterol and fat and plaque buildup. It actually burns that up, you know, to convert it into things like hormones and energy and stuff like that. And so we definitely can, you know, kind of clean out our blood vessels through, you know, like a healthy, like dietary and activity approach. So, but if you're doing this, make sure your exercise recommendations here, make sure you always have like a physician's release. If you're training a client who has a history of coronary artery disease, if they're like, yeah, I had a blocked artery, I had to put a stent in, right? If you have a client like that, make sure they are definitely cleared for exercise before you start training them. To be perfectly honest, guys, if you end up ever like actually having a client like have like a heart attack during a session or something, for the most part, you're going to be covered by your insurance. You're going to be covered by, you know, the fact that you're certified actually provides you with like a very large amount of coverage. You know, those things really do go a long ways, but at the same time, like, it's always worth it to just keep yourself as safe as possible. And part of that is making sure that like you have your client has like doctor's permission to actually exercise. You know, you don't want to do anything that is going to put them at risk. So always make sure that's true. And then always have access to an AED machine, an automated external defibrillator. Now, you guys are all going to get a chance to kind of use one of these. This is going to be part of your, you know, this is going to be part of your training for CPR. You'll get a CPR/AED certification. You need that in order to be able to take your NASM exam. So that's part of your tuition. It's kind of included and stuff. But you definitely want to have one of these machines available. Now, if you got like a home gym, you don't necessarily like have to do that. But if you are, for anybody out there who's like thinking about like opening their own gym, make sure you have a very clearly posted, easy access AED machine at all times, and make sure that your staff knows exactly where it is. So make sure that is happening. And then always with coronary artery disease, test your blood pressure. If you have a client who has coronary artery disease, this is where having a blood pressure cuff is very, very handy. So you can check it before exercise start. If your client's heart rate, or if your client's blood pressure is ever above 180/100, which is very, very high, they really shouldn't be exercising that day. It's honestly best just to send them home. Or tell them to be like, hey, like, my blood pressure is really bad today, and get in touch with their doctor and see what they should do. A lot of times their doctor will just tell them to take like a baby aspirin, which kind of thins out their blood and drops their blood pressure down. But, you know, if their pressure is super, super high, it doesn't make any sense to try to exercise, because, you know, they're probably likely to pass out. Always, when you have a client who is dealing with cardiovascular disease, use the RPE method to continually check in with your client. I don't think you necessarily have to always use the RPE method, but you should absolutely be checking on your client's status throughout the entire session. Just be like, hey, how are you feeling? How did that go? You know, check in with your client very, very, very regularly, because your client's status can change super rapidly, and you just need to be aware of that. You know, like, I've trained plenty of clients who have lots of heart disease before, and they'll be fine one moment, and then just something about their body position or something caused their blood to just pool for just like a second somewhere in their body, and then all of a sudden they didn't get oxygen delivery the way they were supposed to. They get a little lightheaded, they might feel a little nauseous, you know, all these things that your body basically does, like nausea and lightheadedness. These are all kind of like responses that your body had. Someone described it this way to me, actually not someone, my health teacher in 7th grade. I don't know why I remember this. That was always the kind of stuff I remembered in school, was like the weirdo odd facts. But he put it this way, and I always thought it was so elegant. I use this to this day. But basically, like passing out, fainting is sort of an autonomic response that your body has to go, oh, we're having trouble delivering blood around the body. It's a lot easier for blood to travel this way than it is for it to travel this way. So it's time to pass out. And that's why people faint when they see the sight of blood sometimes. You know, some people get like really woozy and they pass out. My uncle was like that. So you just need to kind of be aware if your client's blood pressure is super high, or if their status changes really rapidly. You need to be able to check in with them because they might experience very sudden dizziness or nausea or things like that. Now, if they have coronary artery disease, right, it is not necessarily likely, but it could be possible for them to also suffer from a stroke. So this is another thing that's very common in our senior clients. A stroke is going to be a blocked or damaged blood vessel that goes to your brain. It is the heart attack of your brain. When we look at like blocked, oops, oh my God, I'm forgetting the name of the freaking, so when you look at like what can happen sometimes, you can actually get artery disease in the blood vessels that are headed up to your brain. You kind of have these two big vessels that kind of head up on both sides of your brain there. And if that gets blocked, now this other tissue, your brain, which coordinates everything in the body, you get the heart, which is sort of acting like the engine of your entire body, and then you've got your brain, which is sort of like the computer that's in your car. You know, like it's in charge of like coordinating everything, and your body's not going to know how to run without it. So we definitely don't want to experience like a loss of blood flow to that tissue, especially because that's also very, very oxygen hungry tissue. Like your brain's been working aerobically for a very, very long time, right? So we can definitely see damage in the blood vessels that head up to the brain, and that can be obviously very dangerous for us as well. So this is one that is so dangerous. Like, you know, obviously if your client is having like, you know, coronary artery problems, you should absolutely call 911. But like, if you observe anything, especially with stroke, keep an eye on your client. If they have a sudden known headache with absolutely no cause, and I mean like very severe headache, sudden dizziness that's associated with that, a loss of vision. Now, this is particularly if you see like a loss of vision in one eye. Typically, when individuals are having stroke, it's usually on one side or the other, which is where you'll see like a lot of times like they'll have problems, they'll have numbness, or like one of the things we see is like a sudden difficulty like speaking. You'll see like slurred speech, and what that is basically the right side of their body is, or maybe their left side of their body is being shut down because that's what's losing its blood flow. So the blood flow to the brain that is, you know, controlling one side of the body or the other is sort of lost, right? Those signals are not being coordinated anymore because those nerve cells are no longer able to like do their functions. They don't have any oxygen, right? And so if they see like loss of vision in one eye, or if you start to notice like their face kind of drooping on one side, that's another one. Weakness, numbness in the arms, or especially on one side of the body, all those are immediate warning signs of a stroke, and you should absolutely call 911 as fast as possible. So we know that the same things that often lead to coronary artery disease are the same sort of things that often lead to stroke, right? These are things like high cholesterol, high blood pressure, right? A poor diet, particularly like abdominal obesity, right? All of these things that you know we are kind of aware of. But the good news, I mean, obviously, like everything until now, it's a big bummer, right? The good news is that like a lifestyle modification can reduce your risk of all these things. You know, just simply by getting a little bit of activity every day can reduce your risk of coronary artery disease and stroke. You know, this is where we're looking at those CDC guidelines, right? I always tell you guys these numbers to memorize, but like, 150 minutes of exercise per week. That's honestly what we're looking for. Yeah, I saw this chart at one point. I love this. You can see this is kind of what it would be like, right? Like if you do like 10 minutes of vacuuming and then go up, go for a walk and do 15 minutes of stair climbing, go for a 30-minute walk at some point, play pickleball for an hour, go for a bike ride, and then maybe 30 minutes where you're actually training. That's a great way to like break things up. I love this like little schedule here, but if you were even just getting like 20 minutes of physical activity 7 days per week, that's pretty darn close to what you need. And that's all it is. Just go for a 20-minute walk every single day. It's enough to keep you nice and healthy, or 30 minutes, Monday through Friday. So lifestyle modification has a really high benefit. We know that like obviously like increasing like fiber in your diet and things like that can lower your risk of heart disease and stroke. We know that getting plenty of like antioxidants and vitamins and minerals, all these things are important. So they're not that big of adjustments to make, a lot of times, but they are just like things that need to be adopted into your lifestyle. They don't need to be big adjustments for it to be incredibly difficult for your client to adopt them as habits, which is what's sort of like a huge bummer. I love my folks, but I come from a family of, I call them like silver bullet people. Both of my parents are very much like silver bullet people. They will fall for snake oil and supplement information on the internet. Like they will fall for that stuff like you wouldn't believe. This idea that like the silver bullet's the one thing that can kill a werewolf, right? Like nothing else possibly. If you were to drop a nuke on a werewolf, no, it's fine. Really? Right? Only a silver bullet. My parents are kind of like that. They kind of believe that they'll see like a supplement or an advertisement for something and they'll be like, or my mom loves Dr. Oz. Whew. Anybody else's folks love Dr. Oz? Good Lord. He'll have like, he'll say something on his show and my mom will like attach to it and be like, she's like, Dr. Oz said that women don't get enough vitamin K. And he's right, by the way, most people don't get enough vitamin K. And he said that vitamin K, there's a really good source in pickles. So my mom will be like, I ate a whole jar of pickles today. I'm like, oh my God. That is like, so not the point of like what we're looking for here, or like protein shakes. My parents are always like, they're on and on about like, these amazing like protein shakes and stuff. And honestly, like the big thing that really kind of fixes all of this is not so much like some silver bullet, take this supplement, everything will go away. Take some fish oil pills and it'll fix your heart disease. Eat a bowl of fiber cereal, it'll fix your heart disease. That's not necessarily like a very true way that any of this works, right? What really does work is consistency with like staying active and eating a healthy diet more often than you eat unhealthy. Like taking a healthy protein shake once or twice a week is not going to undo the effects of McDonald's, but that's what kind of sucks is like, we know the answer is actually pretty simple, but doing it is the hard part. That's the part that people struggle with. So looking at hypertension, right? We know that this is an elevation in our blood pressure, right? Anything over 140/90 is considered hypertension. Now you can totally exercise with your clients if their blood pressure is above that. Like I said earlier, though, if it gets as high as like if you have a client with hypertension, you should be continually checking their blood pressure every time they show up for a new session, just at the very top. And it's honestly pretty easy, guys. Like it does not take that long to test someone's blood pressure. And you can even get, like a blood pressure monitor, like an electric one. I mean, I personally, you can just use the, ones that are in your bags and stuff, but look, this is $20, I mean, that's a wrist one. Those kind of suck, but here's a $30 one that's really good by Omron. And Omron's like a company that's really well trusted in making medical stuff. So if you were to, $30 and you just strap it on your client, it takes less than 30 seconds to run. And then, you can tell it's like, great, we're cleared for exercise today. Let's go hit the gym, So recommendations, like I said, if it's above 180 over 100, you probably shouldn't be exercising. But we know that our risk factors for hypertension, right? We know like sort of what leads to this, right? And by the way, 50% of all adults hypertensive. 50% of adults have high blood pressure. That's crazy, right? Definitely runs in my family, you know, very common. So risk factors, particularly, we're seeing obesity here, particularly abdominal obesity. This is one of the reasons why we test that waist to hip ratio so often, because abdominal obesity is a much greater risk factor. When we're looking at like hypertension in particular. Physical inactivity is a big one. Obviously that leads to, you know, not burning off very much energy, which means, you know, that energy has to accumulate somewhere. A stressful lifestyle can lead to hypertension. We know that like the more often people are stressing out, they're creating like cortisol and hormones and things like that that are very negative and have very negative impacts. A poor diet is obviously a big one. Don't really spend too much time on that. Family history is big, and this is something that kind of runs in your family. One thing that's kind of a bummer about high cholesterol in particular. So cholesterol, right? We're going to see this in just a second. It's elevated lipoproteins in your blood. Some people respond differently to cholesterol than others. Some people's cholesterol cells are just more easily converted into hormones than other people's are. That's one of the reasons why your doctor will ask you your family history about heart disease and things like that, because they're basically going to look for this. Doesn't mean that you can't combat it, just means it's something we all need to kind of be aware of. And then that is like sometimes racial as well. We will see like certain ethnicities are more prone to hypertension in particular than other diseases. You know, these are just things that are going to kind of happen based on like your genetics and stuff. Again, our goal is to stay as active as possible to try to combat this. So when you're exercising with your clients who have hypertension, be careful to avoid any isometric lifting. We've talked about that before, right? Heavy lifting as well, if it happens to be like it's so heavy that they're lifting really slowly. We definitely don't want to do that because that's only going to raise pressure. Avoid holding your breath during any exercise. That Valsalva maneuver where you take a big deep breath in and exhale through pursed lips is great for creating intra-abdominal pressure, and you should totally do it on leg day if you do not have blood pressure problems. If you have blood pressure problems, we actually want to make sure that our client is breathing normally, which is one of the ways that you can do this is you have your clients count their own reps out loud. I hate doing that. It always feels like I'm punishing my clients when I do that, but like it is a super, super effective method, guys. Like if you've got a client, you're like, hey, stop holding your breath. And the next step, they're like, hey, breath, breathing, right? Hey, exhale, you know, like it's like, all right, that's it. Count your own reps out loud. I want to hear every single one. Like, and it works. It kind of does the work for you. But you know, after a while, like of just being like, breathe, you know, like your client's like, oh yeah, right, sorry. Yeah. I don't know what it is, but people just love to hold their freaking breath during exercise, especially senior client. I don't know. That's another weird thing. Seniors hold their breath more than any other type of client. You know, you would think this is just like a habit that one person would have versus another, and it wouldn't matter how old they are. But maybe this is confirmation bias. Maybe this is just me noticing things because I'm paying closer attention to seniors, you know, because I'm worried about their breathing a little bit more. But man, my senior, it's always a senior client. They just hold their breath. It's like, stop. Like, so next thing we look at is dyslipidemia. Or high cholesterol, right? So this is elevated lipoproteins in your blood. Those lipoproteins can cause blockages or it can at least increase your blood pressure. So I'm actually kind of curious what we get if we look at the picture of this. Dyslipidemia. Oh, good. Yeah. Yeah. Same picture as high blood pressure. So we're seeing like dyslipidemia. You know, this is basically, again, it's a buildup of cholesterol on the inside of your wall, the cells of your walls of your blood vessels, not your cells. So really quick, I do want to show you atherosclerosis. Where's the quick one? There it is. All right, here's a quick little video kind of describing atherosclerosis and then the buildup of plaque on the inside of the blood vessels.
Atherosclerosis
Oh, hold on. Share audio. Put the button. There it
is a life-threatening disease that may have begun to develop during childhood. This condition is a process in which deposits of fatty material, called plaque, build up inside the walls of arteries, reducing or completely blocking blood flow. In extreme cases, this disease can lead to a heart attack or a stroke. Risk factors for atherosclerosis include high blood pressure, high cholesterol, tobacco smoke, diabetes, obesity, and physical inactivity. Although the exact causes of atherosclerosis are not clear, many scientists think it begins with damage to the inner wall of an artery called the endothelium. Over time, substances traveling in the blood, such as cholesterol, fats, and cellular waste products, accumulate inside the damaged area of the arterial wall. Chemical reactions occurring within the buildup of material cause cholesterol molecules to oxidize. This initiates an inflammatory response in which the endothelial cells at the damaged site release chemicals that signal a call for help. In response, monocytes from the bloodstream travel to the damaged site. Stimulation from oxidized cholesterol converts the monocytes into macrophages. The macrophages eat and digest the cholesterol molecules. As a result of this process, the macrophages change into foam cells, which accumulate to form plaque. As the plaque increases in size, the arterial wall thickens and hardens. At the same time, smooth muscle cells within the arterial wall begin to multiply. Then, most of the smooth muscle cells move to the surface of the plaque. These cells contribute to the formation of a firm, fibrous cap covering the plaque. Over time, the cap may erode and break open, releasing plaque into the bloodstream. The plaque can flow downstream and contribute to the formation of a blood clot, which can stop blood flow. As a result, limited blood supply is available to the areas surrounding the partially blocked artery, degrading and potentially killing the neighboring tissue. Significant damage in organs, such as the heart or brain, can result in a heart attack or a stroke.
So basically, when you look at this, when you look at like what's happening here, it'll sort of start with what we call like a fatty streak. Let's see here. Stages of atherosclerosis. There we go. So what you'll start to see, is a little bit of like a buildup, and you'll have like this little endothelial dysfunction. Something will happen which will create some type of damage in the blood vessel, whether that is excessive levels of stress, or it could be just excessive levels of like too much cholesterol building up on the walls themselves. You'll have some type of like dysfunction that happens, and then what happens is cholesterol starts getting stuck on this little bit of texture that you created, right? Like this was a very smooth vessel, and then now it's got this like, crack or tear, or, not even that, but just like a little bit of like texture. It's got like, it's bumpy now. And so now cholesterol molecules will actually start grabbing onto that, and they get stuck there, right? Because fat, tends to be a little greasy, right? Tends to stick to things. And so what starts to happen is you get what's called a fatty streak. And then what'll happen is your immune system goes, oh, there's something stuck in our blood vessels. We should go, eat that thing, because that's what your immune system does. But unfortunately, when it eats way too much cholesterol, what ends up happening is it ends up actually taking these white blood cells, which were there to like kind of eat up the cholesterol and stuff, and they end up kind of inflating and getting filled with more and more and more and more fat. And so they kind of inflate, and then they become like these really, slow moving, really heavy cells. And then they're stuck there within the walls of your blood vessel. And then what your blood vessel will do is it will actually build over, it'll kind of cover over. It'll be like, man, we have this nice smooth inner wall here. Now we need, we need that again. We need some type of like smooth inner wall. So it'll actually build a wall over the plaque. So now you're going to have plaque building up on the inside of the blood vessel's wall, essentially. And that can rupture at some point. That can become very unstable, and that can rupture, which is where we get like blood clots and things like that. And that's sort of what we're seeing. I saw a picture of it just a second ago. Yeah, we see something kind of like this, right? And that can cause clotting to form as well. Like, but that's what's so dangerous about atherosclerosis, right? So dyslipidemia, or high cholesterol. And when we say high cholesterol, we mean like high, bad cholesterol. We're talking about the low density lipoproteins, the LDL, lazy density, flows through your bloodstream, gets stuck on the walls very, very easily stuff. Not the high density lipoproteins. Your HDL cholesterol is your good stuff. Like that's the stuff that honestly, as it's going through, it actually picks up low density cholesterol. It actually kind of cleans it out because they're sort of attracted to each other. And so the HDL stuff will sort of grab it and convert it. And well, sort of take it into its being, right? So if we have like a bad ratio of LDL to HDL cholesterol, that's when we start to see those elevated lipoproteins in our blood. They get built up because they're not being converted into hormones. We need cholesterol. Cholesterol is a very important part of our biology. It's how we create like a lot of hormones and different cell walls and things like that. It's when we have too much of it that it starts building up on our cell walls that it becomes really dangerous. So that's what we're talking about when we say like atherosclerosis, right? So obviously the big recommendations here are going to be aerobic exercise, particularly like long duration activity is very big here because that's going to give your body time to kind of continue elevate your heart rate, continually use it. And honestly, guys, it's the way I kind of like to think about it is like, when you've got something on like a dish, and you're trying to like, you're using your sink, you run the water over until it finally blasts off the walls. That's kind of what exercise does, it really does. It's kind of pumping blood through the system. And when you're elevating your heart rate, you're raising your blood pressure and you're raising your heart rate. Your heart's pumping a little bit stronger. And so that's really trying to just kind of clean out those walls, kind of blast everything. So we're going to recommend 150 minutes per week. Just that much exercise has been shown to have incredibly positive effects on your cholesterol. Now, if you combine that with like a healthy diet, you're going to be hitting it from both sides of the equation. You're going to be burning up any fats and converting them into hormones as you exercise. But then you're also only going to be supplying yourself with healthy fats, which are only going to like help, again, clean out the blood vessels and stuff. So that's what we're looking for in heart disease. Now, kind of pivoting out of that, heart disease is very much like, I don't know. I guess I had like a point. Now I'm kind of like losing it on myself. I guess it's its own type of disease. I mean, your cardiorespiratory system really is. It's such a big support system. It really is like its own kind of thing. But looking at diabetes is a little bit different. Diabetes is more of a metabolic disorder. This is where your metabolism is basically broken because one piece of it's not working the way it's supposed to. So diabetes is impaired glucose control, right? We have two different versions. We either have type 1 diabetes, which is not as common. There's only about 10% of cases or so that are type 1. But that's where basically you get a bum pancreas that really just isn't working the way it's supposed to. It's not creating enough insulin to pull sugar out of your blood. But type 2 diabetes, which is 90% of all cases, is the one that happens when your blood sugar levels are elevated for such an extended period of time. What ends up happening is your body's cells actually become resistant to insulin because insulin's job is to trigger the storage of glucose. It's either going to trigger glucose becoming glycogen, or it's going to turn it into triglycerides to be stored as fat. And that's what insulin does. It gets your levels back to normal. So whenever we want to like perform activity and we want to do exercise, we're going to get that energy from our glycogen stores. It's like, I want to do some physical activity. And so your glycogen stores are going to, be like, all right, well, here's some sugar that we stored up from earlier, right? So you're constantly burning up glycogen for fuel, and you're constantly taking, blood sugar and converting it back into glycogen. You're refilling it as soon as you use it. But if you are continuing to elevate your blood sugar levels super, super high consistently, what ends up happening is, your glucose levels pretty much are so elevated that your cells are becoming resistant to it. It has to make so much insulin that it's kind of like when you drink too much coffee, it doesn't work it doesn't hit the same as it used to. So type 1 is your immune system is basically attacking your insulin producing cells. Your pancreas isn't creating as much of it as it's supposed to. And type 2 is we call it non-insulin dependent diabetes, even though they will often, which is a very name that kind of doesn't make, it's a sort of a misnomer, because it's like, I know people who are type 2 who take insulin. Yeah, they shouldn't have to take it, right, is the problem. That's why it's non-insulin dependent. But basically their insulin is just not binding to their receptor sites the way that it's supposed to, so it's leaving their blood sugar levels super elevated. Again, this is very commonly caused by, physical inactivity. When you are not as active as you are supposed to be, you are simply just not burning through those glycogen stores. And it's also caused by, obviously, just having way too much sugar in your diet. Ideally, you want to have your sugar, guys, it should be less than 10% of your total calories per day. So if you're on, let's say, a 2,000 calorie diet, that's 200 calories from carbohydrates. There's 4 calories per gram. That means you get about 50 grams of sugar per day. And then if you look at your classic, let's say Starbucks Frappuccino, nutrition facts. Let's take a look here. 1 bottle, 32 grams of sugar. So you are about 60% of the way through all of the sugar that you are allowed to have in just 1 drink. Not awesome. And then if it's, wow, look at that. A s'mores Frappuccino, good God.
Yeah, that's a lot of sugar.
Right?
Wow.
67 grams, good God. And then 20 grams of fat. Man, that is, I'll bet you that is the most delicious thing on this planet. Man, that's the thing, man. We got this dumb cave person brain, this is just like, when something has a lot of fat in it, our cave person brain is like, what a great source of calories in this world where hunting is difficult. But we don't live in a world where hunting is difficult, or in sugar, your brain is like, oh yeah, this is why these things are so addicting. That's why they taste so good. Yeah, so, we definitely want to be cautious with that. And it sucks because you get sugar from bananas, you get like 25 grams of sugar in a banana, and a banana is really good for you. You get like 30 grams of sugar in an apple. We really don't have a lot of room in our diet for added sugars. I had blackberries for breakfast this morning. And tomatoes are high in sugar. Like naturally healthy occurring sugars, but still, these are definitely things to be aware of. So, exercise recommendations, we definitely want to focus on, if your client, we want to improve muscle mass, particularly putting a couple pounds of muscle on your diabetic clients is actually very, very, very helpful, because that increased muscle mass, muscle is a very anaerobic tissue. And when we look at the differences between, when we look at the difference between aerobic, which is long duration exercise, and anaerobic, which is short duration exercise, anaerobic activity, short duration stuff, primarily relies on carbohydrates as a fuel source. Aerobic activity primarily relies on fat as a fuel source, which is why we really like long duration, low intensity exercise for our clients with heart disease. And with our clients with diabetes, we actually kind of like a little bit more of the intense anaerobic activity. This is why interval training, which is where you are alternating between anaerobic activity and aerobic activity, interval training has been shown to be so effective for helping with clients who have diabetes. It's one of the best ways to kind of improve your glucose metabolism. So, improving that glucose metabolism is going to be a very big important part of like what we do. If you're doing that, make sure that you are, trying to improve your client's muscle mass. Muscles are going to consume glucose as a fuel source much more effectively. And then keep it on, your client's going to be testing their blood sugar pretty regularly. Ensure that they're not exercising if their blood sugar levels are greater than 250 milligrams of sugar per deciliter of blood. They're going to know that they're testing and stuff. If it gets that high though, instruct your client like, hey, an hour before you come in, like always test your blood sugar levels, want to make sure that your blood sugar levels are normal before we start exercising. If their blood sugar levels are super, super high, what will often happen is it will actually cause their blood sugar to crash mid-workout, because all of a sudden their body will kick into exercise mode and it'll rip all that sugar right out of their blood. And they will often they'll get a huge insulin response and it could cause them to get nauseous and pass out. If that ever happens, make sure you have some simple sugars available in the form of like fruit, something that can be absorbed and raise those blood sugar levels back to normal pretty quickly. Make sure those are on hand if your client becomes hypoglycemic. So that can happen as well if your client's blood sugar levels are super, super low. Ensure that you're always training in a safe environment, especially with balance training, due to the fact that a lot of times one of the things that happens with diabetes is that we experience what we call peripheral neuropathy, which is basically where there's so much sugar in the blood that your nerve cells cannot get enough oxygen delivery. There's sugar sort of blocking oxygen's ability to kind of travel. And so what you'll often hear is people will describe it as like pins and needles in like their lower extremities, particularly in the feet is where a lot of people will feel it. And so if your client is dealing with that, they might struggle with their balance more often due to that numbness or tingling. Proper footwear is really important. Make sure that your client is always wearing good shoes. That's a really big deal when it comes to diabetes, because it doesn't seem like we are going to spend our much time talking about like shoes that our clients would wear, but like we need to ensure that they don't get blisters, because they might not be able to feel that blister on the bottom of their foot. And if they aren't aware that they have it, it could get infected. And then, that's very, very dangerous. So be aware of the fact that diabetic clients are often dealing with neuropathy. COPD, chronic obstructive pulmonary disorder, right? This is going to be a condition that severely affects or limits your lung function, right? Asthma is an example of this, emphysema is an example of this, or just simply chronic bronchitis, right? All of those are basically where you are obstructing airflow into your lungs. There's crap covering your lungs basically, right? So if that's, we see 17 million Americans are affected with this, very, very common disorder. That is going to make it harder to get oxygen into your bloodstream. It makes the exchange of gases more difficult, And I know that we've all been wearing masks for a year and they can be kind of a pain in the butt to breathe through, but your mask is only limiting the amount of gas that happens to be traveling into your lungs. The concentration of oxygen, though, is still very, very high. So what's happening is you're going to diffuse oxygen exactly the same. It's not actually harder to breathe with a mask on, even though it feels harder to breathe with a mask on. But when you have emphysema or chronic bronchitis, you are actually covering where your oxygen is traveling, right? So you may be bringing in plenty of gas into the chamber, but then that chamber, that gas cannot get into the actual oxygen cells because there's maybe tar or, fluid or phlegm, covering the whole thing, right? So with a COPD, you're going to want to use the RPE scale with your clients, right? You want to continually check in to see like how they're feeling, because that shortness of breath can be very scary a lot of times, right? So with your COPD clients, make sure you are always encouraging them to breathe properly. Proper breathing patterns are going to be hugely important here. Do not let them hold their breath. For the most part, they often won't, just because, again, like they're kind of nervous about stuff like that. Yeah, this is a condition they're dealing with 24 hours a day. So they're definitely going to be more willing to breathe, but it's good to make sure they don't ever hold their breath. It's good to make sure they get into a normal breathing rhythm. Instruct them to avoid any isometrics and high intensity lifts, kind of similar to our hypertensive clients, even though these conditions are not at all related. We want to avoid isometrics and high intensities because that often causes people to hold their breath. Again, Valsalva maneuver, totally inappropriate. With a client with COPD, that's going to make them feel like they literally can't breathe. And then teach them to be aware of their posture. A client with COPD is going to have a harder time breathing when their rib cage is closed down, right? Like when they're in a posture that's actually like closing their rib cage off, that's going to make it much more difficult to draw oxygen in. So proper posture is going to help with their breathing mechanics. Instructing them to get their shoulders back. A lot of times you'll see COPD clients, they often have like sort of elevated shoulders. Loosening that up so that their rib cage can move the way it's supposed to is going to make it a lot easier for them to breathe, and it's going to be a big quality of life improvement. Now, if your client is struggling with arthritis, this is a very common condition in our senior clients, damage or deterioration of these structures within your joints, right? So we've got osteoarthritis, which is sort of just like the general, we call this degenerative joint disease. It's the sort of gradual wear down that happens over time within the joints, right? But then there's also rheumatoid arthritis. And rheumatoid arthritis is an autoimmune disorder. This is actually where your immune system is sort of putting way too many cells in the area. So if you look at like osteo, if we look at the difference here, right? We can see here's a normal healthy joint, right? We can see there's lots of space in between the structures. There's cartilage covering the structures, making sure that you can see here's like the plenty of cartilage. Here's like the joint capsule. It's kind of keeping everything held in place. Here's your membrane covering the outside of that capsule. And then, you've got the bones themselves. Well, if that space starts to get limited due to like years of physical activity, you'll start to see like the bones will actually start to rub together. We'll see the cartilage will get broken down. The space between the joints will be limited. And that's going to lead to like a rubbing sensation. It's going to lead to bone spurs and damage and, all kinds of aches and pains. Primarily like a lot of inflammation, right? Well, we've also got, rheumatoid arthritis, right? Where we see, your body is actually hardening, swelling, and inflaming the connective tissue within your synovial membrane. So with rheumatoid arthritis, that's where you'll often see when you look at like people's joints, sometimes you'll see like the joints are kind of knobby, and like it actually can be very, very painful because it'll actually cause like malformations in the joint and stuff. We're basically getting this hardened tissue building up within the capsule of the joint, right? So we can see there's all this extra tissue forming up there, and that's sort of what causes those joints to start bulging a little bit. There's just way too much articular tissue. So our exercise recommendations, this is very painful, right? This is achy and painful, and obviously the more painful it is, well, the more inflammation that causes, right? So with our recommendations here, we want to avoid excessive ranges of motion. Hyperextension or hyperflexion movements should definitely be avoided. Don't let your client ever lock their joints out. That's a very bad habit to get into. It's a good rule of thumb, by the way, for pretty much any client, but it's especially important with arthritis. And then do not keep your joints in a fixed position for extended periods of time. This is particularly a problem with rheumatoid arthritis. When you do isometric exercises, like if you were to do a wall sit with a client who has arthritis, rheumatoid in particular, it will often cause things to be much worse. Holding that position for a long time triggers an inflammatory response, and that inflammatory response is very painful, right? So be a little cautious with that, particularly with rheumatoid arthritis, but with both of them. And then progress very slowly. Make sure you're not, amping up your intensities too quickly. And then exercising in water can actually be really helpful for clients with arthritis, because that takes all the pressure, that allows their joints to sort of expand a little bit, with that lack of gravity. So this is where, the bummer here is that we know weight-bearing exercise is the best when it comes to like a lot of like bone density things, and it's really good for osteoporosis. But being underwater and exercising, using like styrofoam dumbbells or resistance bands or just going for a swim, that may not necessarily be the greatest for bone density, but it's incredibly good for taking the pressure off the joints. So if you're trying to like build up someone's cardiorespiratory system, exercising in water can be a really, really, really great tool at your disposal. Get an aqua aerobics certification. I got mine I got the old AFA one. Let's see here. I don't even remember what mine's called. Aqua aerobics. I think that's what it's called. But I was able to do mine in an afternoon. Literally it was like a couple hours. And boom, suddenly I knew how to teach a pool class, crap, where's that guy? No. See, they changed everything when it got bought by NASM. Looking for a picture of a pool here. Oh, can't find it. Well, anyway, just they maybe don't go with AFA. There's other ones out there as well. But we really like aquatic aerobics. It's really good for your clients with arthritis. It can help take the pressure off. Osteoporosis, a little bit different than arthritis. This is actually a condition, and it's still a skeletal system disorder, but this one, not so much in the joints. This is a problem in the bones themselves. This is low bone mineral density. This is where fractures are very common. Particularly, we're going to see a lot of exaggerated kyphosis. When we look at this, we'll often see like sort of this rounding in the upper back, this sort of, we call it a kyphotic spine. And that happens because like the density within the bones actually decreases. And so we'll see, let's see your discs, bone density. I'm not actually getting the picture. Kyphosis, osteoporosis. Hook me up, internet. That's close. Huh. I don't know why I'm not finding the picture I want, but you'll basically see like a decrease in that bone density. That density gets so much smaller, the bones literally start to shrink. And so, yeah, there we go. I guess that kind of works. So we can see like here's a normal vertebrae. And then here's where like that bone's becoming compromised. So we're starting to see this increased exaggerated curve, right? Our recommendations, obviously, like we know that like fractures are going to be much more common. If the bone is not as dense, it's more likely to break, right? So be cautious of that. Much more likely to deal with this in our postmenopausal female clients. They are much more likely to deal with osteoporosis due to a reduction in estrogen production. We see a reduction in bone density, but it's also common in anybody pretty much over age 70. Smoking can actually cause this. The chemicals that are in cigarettes can actually lead to decreased calcification of bones or low body mass. You'll see this in young people sometimes who might be struggling with like disordered eating. If we do have like an eating disorder client, low body mass can absolutely result in low bone density. So most common sites that we're going to see problems are going to be in the wrist, the upper back, and the femur. Those are the areas where fractures are sort of most common. If that happens, that's obviously extremely painful. And again, we talked about this earlier, hip fractures are a big risk factor for, premature death in senior clients because they cause you to be much less active. You become much less active, you end up struggling with diabetes, coronary heart disease, all these other problems. And one of the ways to look for this again is that exaggerated sort of upper back rounding, right? So we can mitigate this bone loss, right? We can sort of combat this by exercising at relatively high intensities. High intensity exercise in particular has been shown to have really, really positive effects. This is one of the reasons why we like weight bearing exercise so much. It's so easy for us to sort of increase the intensity by raising the weight up, right? However, always be cautious. Avoid any exaggerated spinal flexion or spinal extension. You can do crunches, but make sure that they're not exaggerating that range of motion too much. You can do, Supermans and things like that. But again, avoid too much hyperextension there. And always encourage your client to breathe through their diaphragm so that can help them, open up their chest and kind of stay upright. Another recommendation, guys, if you've ever seen these in gyms, they're very expensive, but if you've ever seen like the power plate, this is like a piece of equipment that basically vibrates like crazy, and you can do exercise on it. And those vibrations actually have been shown to have really, really, really positive effects on bone density. So she's going to do her squats here, right? She's on this vibrating plate, and those vibrations kind of travel up. And they're really, really good at actually, in particular, like for senior clients, if you work at a gym that has access to these and you're training like a senior client, this is some of the best stuff you can do. They're super weird. They feel really weird. Like if you spend too much time on there and then like you step off, it's like the whole world is a little odd. And then lastly here, we got low back pain. This is general low back pain. Not so much like a disease that somebody caught, sort of something that just kind of developed over time. But this is pretty much any and all conditions of like low back tenderness, low back pain. 80% of adults are going to experience chronic low back pain at some point in their lives. That's low back pain that lasts, several weeks. The most common of which is lumbar stenosis, which is a narrowing of your spinal canal. I have a little bit of this. This runs in my family like crazy, but it's where basically the canal, if you look here, of your vertebrae actually becomes a little bit more narrow. There should be a nice amount of healthy space here, but if there's too much bone, like too much calcification, that can narrow that, and that can actually cause that your spine to your spinal canal to basically kind of smack around on this bone, which causes like signals and stuff. And there can be a narrowing here. This is where we see like narrowing in one particular area, but very, very common. You'll usually be able to spot it if your client ever gets like an X-ray. It'll look kind of like this. I'm looking for a good example. I'm not actually that great. Oh my God, there's a really great example. Holy crap. So you can actually see like very limited space. Yeah, that's totally what I was looking for. You can see very limited space in between these discs here. That limited space is obviously going to lead to a pinching action. You can also see if we're looking from the side, right, there's pinching, here, but here there's a normal amount of space. Like there's a healthy joint right here, but then there's a lot of pinching, right? So that narrowing of that cavity means that, you know, signals from your spine are going to get interrupted. It's going to cause like a numbness, a tingling, or just general aches and pains. So if you have a client with low back pain, obviously the big thing that they're struggling with is stabilizing their spine as it's moving through like a full range of motion, right? So core stabilization exercise is proven to be a very effective relief for low back pain, and it can have a positive effect within 1 week. You know, like it doesn't even take that long. This is one of the reasons why you can look up, again, the McGill Big Three is a really big one, or Julie Sarman. She is a very famous physical therapist as well. Her studies have been much more linked to sort of how to get back to spinal stability. It doesn't have any pictures of her. Let's see, Julie Sarman exercises. This is how about, oftentimes her stuff has been used for how to get back to spinal stability after having like a baby. Because if you've had like a C-section or even just like, you know, going through normal pregnancy and stuff, it really does sort of stretch out and deactivate a lot of your core musculatures. So you'll focus a lot on like movements like this, where you're laying on your back and stabilizing your spine as you are moving the legs through like a complete range of motion. So she kind of breaks it down into like level 1. I think she goes from level 1 through 10. Level 1 is literally just laying on your back, learning how to like tighten your core. Level 2 is doing that under just like a little bit of pressure. Level 3 is like lifting your leg up off the ground. 4 is lifting both legs off the ground, I think. I don't really have them memorized, but that's her technique. You know, both those are really big. Stuart McGill, Julie Sarman, both very famous physical therapists in the world of low back pain. So, you know, adhere to healthcare recommendations. Like if their doctor says they should avoid certain exercises, you're going to follow those instructions. Avoid excessive ranges of motion. Again, with low back pain, it is not about moving the spine. It's about learning how to stabilize the spine. Always focus on proper posture and alignment. Obviously, that's going to be huge. But one of the other big things is flexibility training. We know that, like, you know, increasing flexibility can take some of the pressure off the joints that are connected to the low back. So that can be a very effective method as well. So summarizing everything up, we know that our senior clients are definitely likely to struggle with one or more chronic health conditions. Exercise is still very possible, even if they are struggling with those health conditions. We just want to make sure that we know which adjustments we sort of need to make. And so always take into account your client's conditions and any contraindications that they might have, you know, anything that they need to avoid. You know, effective programming, like writing your programs out, sticking to a plan, coming up with like an action plan that's actually going to have a positive effect on your clients is going to always be the most effective method for working with comorbidities. And yeah, I know that a lot of that was pretty much review. We got an 8-day version of you know, this one lecture that we just had, but hopefully that kind of was a good refresher to kind of cement things up. And that is pretty much our final lecture here in PFT 109. You guys got any questions today? How's everybody feeling?
Pretty good, bro.
Pretty good, yes.
All right, love that. Charlie, that's it, man. That's your last lecture.
No,
You had 2 classes left with me, but that's the last like traditional lecture. So yeah, on Monday, we're all meeting up at 9 or 6. We're going to do some in the gym training, which will be really fun. I'm basically going to make you guys, oh, that reminds me. Holy crap. Guys, everyone bring your NASM textbook on Monday. I'm going to print those exercise checklists for you so that everybody can have like a physical copy of one in case you don't have one already. But your assignment, basically, what we're going to do in class is I'm going to say, all right, you are going to put together a workout and you have to choose from here, here, and you're going to have to like look through your book and find the exercises and then build a workout. It'll be your workout. You can choose whatever you want. They'll have some like kind of guidelines to work within, you know, so you'll pull you'll pull out of a hat, basically, whether or not it's going to be a stabilization routine or a strength routine, and then you'll have to like stay on the right checklist and stuff. So we have copies of the book probably, but I never trust us to have enough. So please bring your textbooks on Monday. It's going to really help with that activity. It'll be really fun to kind of put it together. And then, yeah, we'll have our final, we'll play a little review on Monday and have a little, Zoom party. And that's the plan, guys. Everybody's pretty good. No questions today? All right.
I have a question, Brad. So we have homework chapters. Can you kind of recap real quick?
Yes.
And then the
it'll be
exam.
chapter, so in this textbook, it'll be chapter in the senior manual that I sent you, the PDF, chapters 11 and 10. All the questions will come out of those. However, in your regular NASM textbook, chapters that will be very helpful for you is chapter 14. In your regular text, it'll have all those tables. Like we have the big chart that's all 5 tables on one big thing. But those 5 tables will be really helpful because a lot of your homework questions are going to be things like which rep ranges are appropriate for clients in hypertrophy, and it's 6 to 12 reps. Or they'll say what intensity is appropriate for clients in stabilization, only 50 to 70, So those tables will be very helpful for you to reference. Either chapters 10 and 11 in the senior manual or chapter 14 of your regular NASM.
Perfect. Okay, thank you.
Yeah, no problem. All right, guys, that's about it. Adios, amigos.
All right, Brad. See you Monday.
See ya.